Your breast cancer risk, what you can control and what you can't. Could I have prevented this breast cancer? Most people ask me this, and it's a difficult question because the answer is not simply yes or no. And in this video, I'm going to explain what increases your risk of breast cancer, what you can control, and what you can't. Breast cancer is the most common cancer in the UK, and every year, just under 60,000 people are diagnosed with it. That's around 150 a day. And the causes are not fully understood, but research is improving our knowledge about the risk factors. First, it's important to understand that breast cancer is not caused by one single thing. It's the result of multiple risk factors interacting over time. So instead of thinking in terms of cause, we think in terms of risk. Non-modifiable risk factors are those things that you cannot change. Age is the biggest risk factor. The older we get, the higher the risk. Sex, this one is obvious. Breast cancer is more common in women, but men can also be affected. See my other video on breast cancer in men. Genetics. Now, some people carry genes that significantly increase the risk of breast cancer, but they are relatively uncommon. You have probably heard of genes such as BRCA1 and BRCA2. However, there are more genes that are currently being routinely tested. And these include genes such as PALB2, CHEK2, and ATM. Having close relatives with breast cancer can increase your risk. This, however, is not as straightforward, and advice can be sought from professionals who are experts in assessing this risk. Hormonal factors. Essentially, this is related to a longer lifetime exposure to estrogen, which is caused by early periods, late menopause, and these are things that you cannot change. And importantly, many people who develop breast cancer may have no obvious risk factors at all. Now, let's talk about what you can influence. Weight and body fat. Particularly after menopause, being overweight increases the risk of breast cancer. And this is because of fat tissue producing estrogen. Alcohol. Even small amounts of alcohol increase breast cancer risk, and the relationship is dose dependent, so the more you drink, they increase your risk. And there is useful information and advice from the World Cancer Research Fund, and the link for this is provided on the notes below. Physical activity. Now, it is clear that regular exercise reduces the risk of breast cancer because it helps to regulate hormones, your fat distribution, and inflammation. Diet is extremely important. There is no single anti-cancer diet, but there are certain patterns that are clear. More whole foods, less processed food, and a balanced nutrition with fruits, vegetables, and fiber-containing foods being prioritized. The Cancer Update Program of the World Cancer Research Fund have published an update on the dietary and lifestyle patterns for cancer prevention. And if you're interested in reading some more, there is a link provided in the notes below. Hormones. There is strong evidence that breastfeeding your baby can lower your risk of breast cancer. And that's why one of the cancer prevention recommendations from the World Cancer Research Fund is to breastfeed your baby, if you can. Babies who are breastfed are also less likely to be overweight as children, and this makes them less likely to be overweight as adults too, which can help reduce their risk of developing some types of cancer later in life. Some types of hormone replacement therapy, particularly the combined HRT, can increase risk. There is also a very slight increased risk from oral contraceptive pill. Of course, all of this needs to be balanced carefully with the benefits of HRT and the contraceptive pill. This is where things become really important. Research suggests that around 20 to 30% of breast cancers might be linked to modifiable risk factors. That means that some breast cancers are potentially preventable, but not all. Avoiding guilt is a very important message. Even if you exercise, eat well, maintain a healthy lifestyle, you can still develop breast cancer. That's because we don't fully understand all of the causes of breast cancer. And if you do develop breast cancer, remember, it is not your fault. If you want to reduce your risk of breast cancer, focus on maintaining a healthy weight, staying physically active, limiting alcohol, and being aware of the hormonal risks and attending screening. These are all evidence-based steps. Now, we've been talking about prevention, but equally important is early detection, because breast cancer found early is more treatable and often curable. So to summarize, some risk factors you cannot change, and some you can influence. And whilst not all breast cancer is preventable, you can reduce your risk. Focus on what you can control and let go of what you can't, and stay informed.